Hello and welcome. My name is Jean Edward. I'm an assistant professor in the College of Nursing at the University of Kentucky, and I'm also a nurse scientist for the Markey Cancer Center at UK Healthcare. Today I'm going to be talking about health insurance literacy and providing an introduction and overview to the concept itself as we prepare you for the upcoming modules in this training. This module will cover a lot of information, particularly around defining the concepts of health and health insurance literacy. Also, we will take a look at statistics on health insurance literacy nationally and in Kentucky. We'll look at how consumers understand health insurance terms and concepts. We'll also look at how Kentuckians understand their health insurance. And finally, end with an overview of looking at the type of coverage that Americans currently have. So what is health literacy? You may be very familiar with this concept. Health literacy refers to an individual's ability to not only read, write, and understand health information, but to take that information and make appropriate decisions in regards to their health. An example of this is a patient understanding their diagnosis of breast cancer, but also above and beyond understanding the concepts of breast cancer, they also know what treatment options are available to them. And then they're able to take this information, process it and understand it, take it to their next appointment, and they're able to have a conversation in the healthcare field, what we call making a shared decision along with their provider to find the treatment plan that best suits their needs. And the goal of this is that patients will be satisfied with the treatment plan and adhere to the treatment plan that's prescribed to them. And that's ideally what the concept of health literacy really means, is starting from an understanding all the way through to having positive health outcomes. Health literacy, research has shown, has a tremendous impact on access to care. Patients with low health literacy are more likely to visit an emergency room because they're more likely to delay preventative health-seeking behaviors such as cancer screening or having an annual checkup with their provider, thus leading them to delay health-seeking and end up going to the emergency room for dire healthcare needs. They're more likely to have hospital stays, they're less likely to follow treatment plans, and they have a higher mortality rate. So health insurance literacy is a concept that we consider falls under the umbrella of health literacy. Health insurance literacy measures the degree to which individuals have the knowledge, ability, and confidence to find and evaluate information about health insurance plans, to select the best plan for their financial and health circumstances, and use the plan once enrolled. Now, as you well know, over the last few years, we've seen tremendous changes in our healthcare system, particularly related to the Affordable Care Act and insurance coverage. Now, one of the main aspects of the Affordable Care Act is that individuals were required to have health insurance, and that required them to understand and be engaged with the process of buying and using health insurance. So the concept of health insurance literacy really grew from consumer research that showed, people were not understanding how to purchase and use their health insurance. We were starting to see some barriers there. And that's really what health insurance literacy, the concept, measures in consumer research. When consumers are provided with health insurance plans, this may be pretty dramatic to think about it in such a way, but people do have a lot of confusion around what health insurance really is. When asked to compare and select health insurance plans, this is what our average consumer may see. Again, we may laugh at this slide when we see it, but that's how confusing health insurance is. But the health literacy and health implications of this are serious. People don't understand the options that are being presented to them, and as a result, they're unable to make the appropriate decisions that best suit their needs. And as you can see in this image, Oftentimes, it's like another language to consumers, and even numbers don't necessarily make sense within this context. Now, the research shows over and over again in the last decade that the average American has difficulty understanding basic health insurance terms. One study showed that 96% of Americans don't understand basic health insurance terms such as copays, deductible, premium. Another study showed that individuals had trouble calculating out-of-pocket costs, such as how much it would cost them for a hospital stay or out-of-network lab test. Alarmingly, one study showed that a large number of Americans are enrolled in these high deductible health plans. As you can see in the slide, with deductibles of at least $1,300 for individuals and $2,600 for families. While this can be an acceptable plan for certain people who understand that their out-of-pocket costs are going to be high, and also who know that they may not have any foreseeable healthcare issues, for the majority of people who select this plan, what the research shows is that people don't understand why they're signing up for these high deductible health plans. So what we're finding is that people sign up for the high deductible health plans because the premiums are low. So the out-of-pocket initially per month is low, but that can be enticing. But it could be detrimental to their financial well-being in the future if they do have health issues that year. So this particular study went on to show that consumers in high deductible health plans are less likely to engage in consumer behaviors such as being able to compare prices when buying plans or discussing costs related to care with their clinicians. This indicates major health insurance literacy deficits that impact the financial well-being of our consumers. Based on research, it is safe to say that health insurance literacy represents the significant overlap between financial literacy and health literacy. The cost and financial aspects of health insurance can be very confusing to some, and oftentimes when we talk about healthcare costs is when we start to see consumers struggle with understanding the concepts. Here is an example of health insurance literacy, particularly financial literacy struggles among our consumers. These are results from a poll done by the Kaiser Family Foundation. They have an online health insurance literacy quiz that anyone can go online on the Kaiser Family Foundation website and take for yourself to see your health insurance literacy levels. What you are seeing in this graph, at the very top of the bar graph, you see that when people are asked about premiums and deductibles, for the most part, people answered correctly, about 79 to 76%, but relatively better than questions related to costs. So if you keep coming down that bar graph, you see that when we ask about calculating out-of-pocket costs related to a lab test or a hospital stay, people are confused. People are also confused by terms such as formularies, which relates to prescription drug coverage, and people are also confused about who is in network and out of network and how this affects their healthcare costs. A group of us at the University of Kentucky did a study looking at national trends in health insurance literacy. And we were curious to see what were the main areas of health insurance literacy and how did that affect access to care for our consumers in the United States. So we did a secondary data analysis of the Health Reform Monitoring Survey, which is a cross-sectional, probability-based, nationally representative internet survey database. We had roughly 15,000 adults between the ages of 18 and 64 who responded to surveys in 2015 and 2016. And we did some weighted logistic regressions to look at the association between health insurance literacy, sociodemographic factors, and experiences with obtaining health care, while controlling for the main covariates that we would think of, education, income levels, using an alpha of 0.05. This study has been, it's in press, has been accepted for publication in the Health Literacy Research and Practice Journal. The majority of our sample was white non-Hispanic, with family incomes greater than equal to 100% of the federal poverty level, working full-time or part-time, residing in metropolitan areas, were U.S. citizens, had insurance or were insured in the last 12 months, and were covered under employer-based insurance coverage. We had a good distribution between gender, sex, age, education, and marital status. Overall, what we found that was the majority, of around 52% of our sample had inadequate health insurance literacy as measured by knowledge of basic health insurance terms such as copay, deductible, premium. 48% had inadequate health insurance literacy as measured by confidence in using insurance to access needed healthcare services. And what you're looking at here are the results of the logistic regression analysis, which indicates that significant disparities in health insurance literacy exist in this group, with the following groups at high risk for having inadequate health insurance literacy, including young adults, women, Hispanics, having less than a high school diploma in terms of educational attainment, not being married, unemployed, having incomes below the federal poverty level, non-US citizens, those who are enrolled in only public health insurance plans, and the uninsured. In terms of understanding cost of care, we see that our at-risk groups here are, once again, young adults, women, minorities, including Black, non-Hispanic, and Hispanic communities, and as well as those with less than a high school diploma. As we look at continued cost of care analysis, we see that once again, those who are not married with family incomes at or below 100% of the federal poverty level, those who are not working full-time, non-US citizens, and those covered under public health insurance plans also had limited understanding and knowledge around the cost of care. And finally, when looking at access to care, we find that participants with inadequate health insurance literacy were more likely to report having trouble obtaining care compared to those with adequate health insurance literacy, even when we controlled for education, income, and insurance type. Among those who were insured and reported needing care, we saw that roughly 21% reported trouble obtaining care. And as you can see here, those barriers were related to things like getting an appointment, being told by the clinic that their health insurance was not accepted, being told by the clinic that they would not accept them as a new patient, and also having trouble finding a doctor. So this national study, or this study that represents a national population, really highlights the major disparities in health insurance literacy, the at-risk groups, the groups that we really need to focus on to provide resources and additional supports to improve health insurance literacy. We are working on improving our data around health literacy and health insurance literacy of Kentuckians. We have this one study to share by the Alterum Healthcare Value Hub, who found, and they did a survey study here in Kentucky, and they found that Kentuckians claim to understand health insurance, but what they actually understood about health insurance varied from what they claim to understand. So as you see here, 97% of those surveyed claim to know what a deductible is, but only 78% actually knew the correct definition when asked to define it. So there really is a mismatch between truly understanding, being able to define it, and claiming to know what that means. Because we hear these terms so often, we think, yeah, I understand. But really, when we're asked to define it, we don't have a clear understanding of what that means. So the next module is actually going to discuss another study that we have done as a team looking at understanding health insurance literacy among Kentuckians in a particular community. Finally, I want to end with where we currently stand in terms of coverage for Americans. So as of 2019, this is the distribution of Americans in each health insurance plan type. Keep in mind that the Affordable Care Act drastically impacted and reduced our uninsured rates. But with the impending changes in the Affordable Care Act and Medicaid changes across the state, we're likely to see these numbers change in the near future. So the majority of Americans are covered through employer-based health insurance plans. Then we have Medicaid at 21% and Medicare at 14%, followed by the uninsured, non-group coverage, and other public health insurance coverage services. Here is a slide with some resources that you can tap into. Many of these I have mentioned and included in this module, but definitely some great resources to go to better understand the concept of health insurance literacy and to highlight some of the research that supports health insurance literacy issues in our society. Finally, I'd like to end with providing my contact information. Please feel free to email or call with any questions or concerns, and I'd be happy to return your call. Thank you.